Now for a keynote address from our platinum sponsor Sanofi. Joining us now live online is Isabelle Deschamps, Head of Global Vaccines Public Affairs at Sanofi. Isabelle, thank you so much for joining us today all the way from France. Anytime you're ready, please, the floor is yours.
Okay, just testing the microphone first. Can you hear me well?
Yes.
Okay, wonderful. Good morning, good afternoon to the estimated guests. Sandra Gallina, Director General for Health and Food Safety at the European Commission. His Excellency Ong Ye Kong, Minister of Health for Singapore. His Excellency Budi Gunadi Saidikin, Minister of Health, Republic of Indonesia. His Excellency Ling Yong Hoi, Secretary General for ASEAN. Suzanne André, Head of Health and Healthcare Industry at the World Economic Forum. Donald Kanak, Chairman of the EU-ASEAN Business Councils, ambassadors, and distinguished guests. Thank you. First of all, thank you to the EU-ASEAN Business Council for hosting us today. I'm Isabelle Deschamps, and I'm the Head of Public Affairs for Vaccine at Sanofi. Sustainable healthcare delivery and financing has long been a major issue, and not just in the region, but globally. However, never has the importance of sustainable health system comes into such a strong focus than what the COVID-19 has exposed. With the ongoing COVID-19 outbreak, healthcare systems across the world have been pushed to the brink. The approach of traditional healthcare systems to disaster preparedness and prevention has demonstrated intrinsic challenges, such as public hospital being overwhelmed, exhaustion of healthcare workers, and also shortage of medical resources. The pandemic has also amplified pre-existing and underlying vulnerabilities of many healthcare systems around the world, such as the challenges of an aging population and also increasing burden of non-communicable, communicable, and also chronic diseases. As the world continues to grapple with COVID-19, we need to look ahead at how we can be better prepared for the future. So we all need to develop bold, sustainable plans and make the necessary commitment now, not only to guide us out of this pandemic environment, but also to protect society over the coming years and decades. Effective preparedness will require sustainable political leadership, public-private collaborations, it was mentioned by the General Secretary, global coordination and solidarity, and commensurate upfront and ongoing financing. So furthermore, healthcare systems will need to strengthen their resilience to future shocks and meet increased demands for healthcare while staying sustainable over time. So first, on the pandemic preparedness, there is a broad and deep agreement that the world needs to plan for the new pandemic era and be much better prepared, shaped by our experience of COVID-19. The COVID-19 pandemic has highlighted the deficiencies and capacities, constraints of healthcare systems to quickly provide a holistic response to their health emergencies, including end-to-end public-private partnerships. At Sanofi, we strongly believe in the power of partnerships and have long been advocates of such collaborations. For example, since the creation of the US BARDA, which is the Biomedical Advanced Research and Development Authority in 2006, Sanofi has partnered with this agency to accelerate the implementation of similar model of public-private collaborations in key regions and countries in order to ensure the speed, scale, and pooling of investment in research and production. As a healthcare company, we believe it's our responsibility to act and to meet the unprecedented growing needs for pandemic preparedness, including for vaccines. By investing in new innovative vaccine manufacturing sites in Singapore, for example, we aim to strengthen the production capacity for the region in order to meet the ever-growing global demand on vaccine and answer more rapidly to future pandemics. Our other investments in new facilities around the world, in North America, in Canada, and the US, in Europe, in France, for example, will add the manufacturing output and the global availability of vaccines such as our high-dose influenza vaccine. But we are also focused on innovating mRNA vaccines beyond the pandemic to routine use in disease with high unmet needs. We are invested around 400 million euro annually in a first of its kind vaccine mRNA Center of Excellence. And we are committed to rapidly establish an industry competitive mRNA platform and providing our on-the-ground experience and expertise to support the action of governments and other partners to improve the health system and the pandemic preparedness. However, more still needs to be done to meet the upcoming demands and to make health system more resilient. Preventive solutions, such as immunization, can help governments achieving this resilience and the sustainability of the healthcare system, particularly as populations around the world are aging. Let's focus a moment on healthy aging and the role of immunization. The COVID-19 has disproportionately affected people aged 65 and older. While the newer variants of the virus have taken its toll on young and middle-aged patients as well, older adults still constitute a vulnerable demographic, and vaccines have played a role in protecting these vulnerable groups. Of course, the role of vaccine is not just limited to pandemics and outbreak response. They play an important part in healthy aging too. There were 700+ million people aged 65 years and over in the world in 2019. This number is projected to double by 2050. And as for Asia, 62% of the population will be made up of older adults, making Asia the oldest region in the world by 2050. And the fact is that as populations age, their immune system declines and they become more vulnerable to infectious diseases. Many diseases that affect the aging population can be prevented by immunization. For example, the risk of heart attack increased by 6 to 10 times following influenza infection, and the vaccination can play a significant role in reducing this risk. So vaccination is among the most impactful and effective public health intervention of all time. And with the global demographic transitioning toward an aging society, further prioritization of preventive care financing, to include immunization, should be considered by all economies. Indeed, life course immunization is cost-effective. Studies done by the WHO estimate that immunization in low and middle-income countries against 10 preventable diseases can save $350 billion US. In Europe, influenza vaccination saves today 50 million euros every year, when considering both the reduced direct and indirect cost of hospitalization and lost workdays. However, even with these demonstrations, further prioritization of preventive care financing, including immunization, is required. Preventive care is ultimately more cost-effective than infectious disease treatment and cure, yet we typically see less budget allocation than treatment infrastructure. In 2016, to give you a figure, prevention accounted for just 12% of global health expenditure. So in recognition of the importance of life course immunization as part of the healthy aging, global peers have developed comprehensive national vaccination programs to increase the uptake rates of vaccine among older adults, for example, including increasing influenza vaccination coverage in order to meet the 75 coverage target that is currently set by the WHO. It has never been so apparent that vaccination is critical to the strength of our economies. And it's encouraging to see countries and regions taking action to provide robust immunization programs against vaccine-preventable disease. For example, recently in Asia-Pacific, member economies of the Asia-Pacific Economic Cooperation have launched the APEC Action Plan for Vaccination across life course. This comprehensive 10-year strategy aims to enable the 21 member economies to implement resilient and sustainable life course immunization program in order to achieve the WHO Immunization Agenda 2030, and more importantly, to protect the health and the well-being of the population, especially as populations are aging. This plan, in particular, acknowledges that the sustainable health financing is an essential component for achieving these crucial health goals. The pandemic has unveiled the fragility of the global healthcare systems and the opportunity to transform into a more sustainable financing and delivery systems. We need smarter spending that translates into better outcomes. How can it be done? I don't think that we have all the answers to that question today, but we believe the process can start with a focus on resolving inefficiencies and revisiting financing models. I'm delighted to share that with the support of the World Economic Forum, we've been working with KPMG on a white paper titled Charting a Course to Sustainable Healthcare and Financing in the Asia Pacific. We have all heard at the adage, health is wealth. Similar to this adage is the concept of shifting our mindsets to seeing investment in health as an economic driver that can create a more sustainable system in the future, as opposition to being a cost. This paper will explore the concept in greater detail, and we hope to share the findings with you in early October. While this report finding will by no means be a be-all and all solution to sustainable healthcare financing, I'm proud to be part of an organization that is kickstarting much needed discussion and exploration of real action that can start a process of change. While we cannot predict the future, we can be ambitious in trying to achieve crucial health goals around the world with sustainable healthcare delivery and financing and preventive care at its core. Although bridging the gap to sustainable healthcare financing will be a long and sometimes difficult road, I look forward to collaboratively being a great part of this next step. So thank you again for giving me the opportunity to be here today and to share more about this important and timely topic with all of you. Thank you very much.
Thank you so much, Isabelle, for your speech. We really appreciate you joining us live here at the EU-ASEAN Health Summit.